Hi there. Welcome to Doc Talk. As you remember, Doc Talk is the podcast that the Knoxville Academy of Medicine develops so we can talk about health issues affecting all East Tennesseans in plain language. I'm Elise Denaney, former president of the Knoxville Academy of Medicine, and I am so happy to welcome today Dr. Mark Gaylord, who's with the Knoxville Neonatal Regional Associates at the University of Tennessee Medical Center. And really to talk about something near and dear to my heart, because I do have two children, and that's prematurity. First of all, welcome, Mark.
Oh, thank you. Glad to be here.
Today. Okay, so what is prematurity?
Prematurity is any baby that's born before 37 weeks. 37. So 36 weeks and 6 days is considered a premature.
So what's the normal time?
Normal time is anywhere from 37 to 40 weeks. 37 weeks to above, to 40.
Okay.
Yeah.
And it's pretty common.
Oh, yeah. Unfortunately, it's very common, especially in the South and state of Tennessee. Tennessee, we're 11% of all births. So if I give a talk, if I'm in a room, I can ask the crowd, how many of you had preterm babies? 10%, 11% of the hands will go up. So it's very common. I've had two in my family. I've had two nieces born, one at 28 weeks, one at 32 weeks. So it's very common.
That's crazy.
Yes. And unfortunately, our prematurity rate, at least in Tennessee, has not changed in the past 10 years. For the past 20 years, it's gone from about 12% to about 11%. United States runs about 6 or 7%, but over the past 2 years, it's going up. And unfortunately, prematurity and related conditions, along with prematurity, is the most common cause of death in children under a year of life.
So it's not good. It's got lots of risks associated. You know, and the reason why I say it's crazy, I mean, when I graduated from medical school, we did an ultrasound. That was the only technology that we had available. We didn't even have amniocentesis available to us, so, which we'll talk about that. But that's all we did. The ultrasound didn't determine the sex, and now we've got so much that we can do, blood typing and all of that.
Yes. Yes, and you know, we're further along than we were 25 years ago, but still about 50% of prematurity we don't understand. There's a lot of things in prematurity that we do understand. Probably the most common cause, a preventable common thing in the state of Tennessee is smoking. Tennessee is a smoking state, and we have way too many mothers that smoke during pregnancy. Good, adequate, frequent prenatal care. Seeing your prenatal care provider on a frequent basis. Maintaining good health when you become pregnant. And we call that the preconceptional period. And a lot of people don't realize that if you enter pregnancy healthy, you're much more likely to have a healthy baby. Making sure if you have other chronic conditions that they're controlled, diabetes, hypertension, your weight, obesity is associated with prematurity. And as you know, Tennessee is very high in the obesity rate. Other things associated with prematurity, poverty, nutrition, access to care. One of the scariest things in the state of Tennessee over the past 5 years is the closure of rural hospitals. And we've had 2 or 3 just recently close. So 2 in Knoxville, and we've had 2 or 3 in our area just recently closed. And when it's more difficult to get prenatal care, it's a lot less frequent, and women are not able to do that. And then the other thing is payment. If we can, we're lucky that TennCare covers most women up to about 160% of poverty, but it is still often difficult. Some women come on TennCare when they're pregnant, go off when they're not pregnant, so it's difficult to get the type of care that they need to be healthy when they start pregnancy. So it's a whole kind of a multi factors that leads to prematurity.
That's amazing. So even though they smoke 2 packs a day, and so you do, that's not the worst thing in the world. And you shouldn't just knock yourself up for doing that. But what a great opportunity at that point in time to think about, oh my goodness, what a great time to try to stop.
And multiple studies have shown that most mothers want to do right for their babies.
Yeah.
And pregnancy is a great time to get healthy, to stop smoking, stop using drugs, to stop drinking. And most women will do that during pregnancy. But often that takes the counseling from their physician, from their other providers to help them do that. And there are many, many programs in the state of stopping smoking.
Availability to care, you mentioned that was kind of hard because I guess some of the rural hospitals are closing. It is so important to have a good primary care who can coach you with exercise and managing your sugar and managing your diet. It's just hard. It's hard to diet.
Yes, yes, especially during pregnancy.
Yeah, especially during pregnancy.
But there are ways that you can eat right,
Okay.
rather than you don't want to lose weight during pregnancy, but making sure you're using all the food groups, that you're healthy with that you're not drinking too much caffeine, that you're not drinking too much alcohol. But I think that access, and what we're trying to change, at least in our region, is kind of changing our model for access. What we may need to do is more telemedicine. What we may need to do is having prenatal care performed in a rural community, and then babies deliver in Knoxville. So I think we're looking at many different ways to do that. Improved transportation. For most of our folks on TennCare, and about 50% of all births in the state of Tennessee are on TennCare, regardless of where you are in the state. And so they can provide transportation too. So a lot of it is just kind of learning the system and how to get the care where you are and then go to more advanced care in the centers.
I remember talking to one of the families. I said, you don't have to go through this alone. Your healthcare provider can help you with this, but not only that, your husband can help support in the effort, and your family can help support you just by making good food choices, like your family shouldn't be eating McDonald's around you.
Yeah, unfortunately, most of us guys gain weight when our women are pregnant, and because as they eat, we eat, and so you have to be careful with that. But one of the things that I think is really important is that we have to know that this is a real possibility, that delivering a preterm baby is a possibility. It's about as common as breast cancer. And it can be devastating to a family. A baby that's born 17, 16 weeks early may stay with us 100, 120 days. And so it can be devastating for a family. It can be devastating financially. And at least in the United States, most financial bankruptcies are less than $50,000, and it's usually healthcare costs. So prematurity can bankrupt insurance plans. And because of that, many of our insurance friends have programs that if you contact your providers, that can help you with prenatal care and access to prenatal care.
You mentioned telemedicine models that might help with prenatal care. So if an individual who's out in a rural area, even if she can't get to a provider, is taking over-the-counter prenatal vitamins
Yes.
better than nothing at all?
Yes. For sure, she should be able to get at least anywhere in Tennessee. Shouldn't be longer than about 20, 30 minutes to a provider, at least that can do her prenatal care. May not be able to do that delivery. But taking prenatal vitamins and sometimes plus or minus iron, and you want to make sure is very important to the baby. The other thing you want to make sure is that you're using things that have a lot of folic acid, such as whole grains, spinach, other greens, because folic acid has a whole host of things. The primary thing in our area is children that may have myelomeningocele spina bifida. Increasing your folic acid intake is greatly helpful. The other thing that's very important, if you've had a preterm baby, you're much more likely, almost 25 to 30%, to have another preterm baby. And even your daughters are more likely to have a preterm baby. So we know that it is a genetic component to prematurity. And so we have to, if you've had a preterm, or your mother has had a preterm, you need to be seen even before you're pregnant or very early in pregnancy. So a lot of things that our obstetricians can do now that's very important. One of those is progesterone. Vaginal progesterone can help with prolonging the pregnancy so that you don't deliver. And the other one is if you have some preterm labor, be sure to see your obstetrician. We can measure things in the vaginal vault called fibronectin. If it's negative, it's not very helpful, but if it's positive, they need to come into the hospital because they probably are going to deliver preterm. And the other thing that's critical is blood pressure medicine.
Right.
Making sure you manage your blood pressure. Hypertension is a big cause of prematurity.
Okay. Is there any particular activity that a woman should not do?
You should not do drugs.
Okay.
You should not smoke. You should not drink alcohol at any amount. Many studies have shown that we're not really sure how much alcohol is tetragenic or causes abnormal babies. And what we're usually seeing now is not babies that have the phenotypic or how they look to be a fetal alcohol syndrome, but they have fetal alcohol effects. And many of these may not be picked up until they're school age. And so they don't look abnormal in the newborn period, but they may have long-term effects of alcohol. So there's what we advise, there's no safe limit of alcohol or smoking during pregnancy. Smoking is associated with preterm labor, associated with blood vessel constrictions. It can be associated with cancers in the baby, not at later dates, associated with crib death, sudden infant death syndrome. So smoking or anybody smoking in the house is bad. Makes babies smaller. And no one should smoke in the house. And it doesn't even work if you smoke outside and come in, because then you still have all the smoking particles, etc., that are breathed in. So we know that secondhand smoke is bad for mothers also.
You mentioned drugs, and I don't know if we have the answer to this, but what about young moms who have a lot of benefit from using CBD, or a lot of young moms who choose to use antidepressants to help them?
Most antidepressants are okay in pregnancy. Some obstetrical providers will try them off during pregnancy and then put them back on after pregnancy. But the risk of depression in the mother is higher than the risk to the baby. So CBD oil is still, there's a lot that's unknown. Mm-hmm. If you look at ACOG statements for the use of marijuana during pregnancy, it is one of the ones that said not to do. It has been associated with some chromosome breakages, has been associated, I trained in Colorado, and so one of the first states to legalize, and my friends there are telling me that children are having trouble with administrative functions, executive functioning, and everything's dose related, but marijuana is still considered one of those drugs that you shouldn't do in pregnancy.
Interesting. So chromosomes, so like that's their DNA that it just comes, yes. It goes.
Yes. There has been some concern about breakage in genes, and so it is still an ACOG no. American College of Obstetrics and Gynecology. It's something that we shouldn't do during pregnancy. Mothers usually restrict their caffeine. They try to get good exercise, try to nutrition, no alcohol. So, this is, to have a healthy pregnancy, you want to have a healthy lifestyle.
That's pretty basic and
Yes.
pretty common sense too. Okay, so we're going to go to the flip side. I remember we were talking a little bit earlier on moms who are exercise fiends.
What most people talk about in pregnancy is that you shouldn't add things that you're not used to doing.
Okay.
So if you are a runner, it's okay to run till it becomes uncomfortable. If you are somebody that does yoga, or if you're somebody that does other types of weightlifting, other exercises. If you've done that prenatally, if you've done that before you were pregnant, it's okay to continue that as long as you don't add something new or greater. It's far more beneficial for you if you're a walker to continue to do that in pregnancy and be healthy. I think most women will restrict their activity according to how they feel.
Okay, so hypertension, diabetes, obesity, a family history of preterm, all of those are risk factors, and even more important that you take care of yourself and that stuff so you don't have a preterm baby, because it's just not good for the baby. So if I think, let's say I'm at 32 weeks and I think that I'm going into preterm labor, but I'm not sure, I should just go and get myself checked out.
Yes, you should call your obstetrician, your other care providers, let them talk to you, and they can tell you some information that you may need to come and be checked out at the hospital, you may not. But most of the time, they're going to want to see you. That's why as you get further along in pregnancy, the visits become more frequent, to where, from the last month of pregnancy, you're being seen every week. And the reason is to help the obstetricians pick up those signs of hypertension, abnormal blood glucoses, other things, and signs of premature labor, so that sometimes and many times we can stop that and help prolong the pregnancy.
I think that's great, because earlier it was so hard to, one, identify, and then two, to treat and prevent. And now we've come so far that we are able to, just provided that we can identify it.
Yes. If somebody comes in preterm labor, we can check to see if they have positive fetal fibronectin, whether or not they may have had rupture of membranes. We can do fetal monitoring. We can look at an ultrasound. We have some tests with fetal monitoring that tells us of how well the fetus seems to be. And then if that is a problem, we can give steroids, prenatal steroids that can help mature the baby's lungs so the baby's outcomes are better. And we can use other drugs to help stop the pregnancy to where it does not deliver preterm.
I think that's great, because before then you're always worried that something really significant is going to happen to the baby. And so now the worst thing that can happen is mom has to get off her feet, dinner's not going to be prepared, and the house is not going to be dusted.
That's right. A colleague of mine who had 3 babies during our residency, they asked her, they said, well, how do you do this? She says, well, how do you keep your house? She says, well, I help take care of the babies. I have somebody to help with that. But with housekeeping, you just have to lower your standards. There are a lot of times, pregnancy is a hard work. And sometimes you have to take off from work. And sometimes it takes other people to help with that. And that's the other thing that many of us has found that's very important to women that are pregnant, and that's relationships. Relationships with other women is very helpful. One of the most exciting things also in prenatal care is what's called centering of prenatal care. It's where starting at about 30 weeks, instead of it's just you and your obstetrician, it's you and your obstetrician or care provider and 10 other women. Because often they will ask questions and that you might not have thought of or you were afraid to ask. And it's been it's a large March of Dimes study that looked at that in helping to also prevent prematurity. It's called Centering in Pregnancy. We have one of those programs at the University of Tennessee, and it's been very effective because women with women often help each other.
We kind of know.
Yeah. Yes. And you'll ask questions that you might not ask alone.
Right. It's amazing what one person will say, and it will just all of a sudden strike a chord and it'll pop something into your head that really becomes important later on. So relationships are really important. I love that. And it's a great ending note. So thank you so much for joining us today to talk about prematurity, because it is very, very prevalent and it is treatable and preventable, which is key to having healthy babies. And it's hard enough to take care of a healthy baby.
And I thank the Academy. I'd like to thank Knoxville Academy for doing these series so that we can help with our health care in our community.
Thank you. If we need to get a hold of you, how can we do that?
What you can do is call the University of Tennessee Medical Center and ask for the neonatal intensive care unit.
Perfect.
Yes.
Thank you, Mark,
Okay.
for joining us
Thank
today.
you. Thank you.
And that's a wrap, guys.